because we are committed, we are able to get people who can sacrifice their time. That is the greatest asset. People who are committed and passionate about what they do. We also work with like-minded organizations. Like now we have a proposal that is through the National AIDS Control Council. We also work with organizations like CDC. Right. CDC normally supports our activity like Candlelight Memorial, us with money, knowledge, capacity building. We also get things like drugs, ARV. One way or another, they also support, they train community, things like community health workers. You see, with the knowledge base, once you have knowledge, you can be innovative and you are able to move on. So because without that knowledge, how can you move on? How we do some of these things through the skills that we gain from the trainings, and those trainings will always get that somebody somewhere is funding it. And we really appreciate the people who fund us. We are a young country. They are not able to do some of these things. Because recently, if you look at our budget, the money that was allocated for health is less than 5% of the whole budget. And if you look at the Abuja declaration, it calls for 15% for us to really get agencies, governments like the USA, DFID from Britain, World Bank. CDC handles the PEPFAR money. We also will get that our health budget mostly is funded by either grants or support from programs like the Global Fund. I think there are about 5, but I think the American government has, I can say more than a third is from the other side. So without, for now, because the investment we have is not, we've not really reached there. So when they invest on the human capital that we have here, when they train us, when we spread that information, when people have their capacity built, they'll be able to take care of themselves. And at that moment, we can say that now we are able to do it ourselves. We are still working out. Our government does not have a clear sustainability strategy for. It does not have a. For now, it's not there. It's recently when they are trying to look for things like airline ticketing to fund HIV. For now, because you'll find that around 85% of funding of HIV is from outside. So our country is about 15%. Think even if you cannot, how do you think is the government ready to take? Can it do it for itself if that is 15%? And you see, there are things that are coming up like TB. TB is eating into gains that. Wadi duogo awakalo matin wadi kisegi den wabiro mi gine mas. Nen mana ni gari mwati yogo kethre. Gari yo kethre. Through some of these organizations, we've been trained on Action is an American organization. You know, recently I was trained by Your Results USA. I believe that money is from American people. So we were trained on media, the use of media, about interviews, preparing. And I think if you Google me, all those things I've just mentioned them. And if you happen to go for the Action, we go Media Champions, TB HIV Media Champions, trained in Africa. They've also put our profiles on the net. I also have some members of our group. I became a member of that group in 2004. 2003, been a member ever since. I told you again, I sit in the Community Advisory Board, that is HIVR. I also sit in the Constituency AIDS Control Committee. I also represent the civil society organizations, that is for the Kenya AIDS Consortium in this region. Kanko is this organization. It is a member organization of more than 1,000 CBOs in community-based organizations. I've been a community coordinator for the AIDS Candlelight Memorial for more than 6 years. When they said they wanted national coordinator, I applied. Candlelight is a program of the global network of people living with HIV and AIDS. It's basically a grassroots thing. It's organized by the grassroots. Like me, I'm organizing that Candlelight as a community coordinator, not as a national coordinator. But as a national coordinator, some of my tasks are to facilitate community coordinators using my experience and telling them how to prop up a memorial. A memorial can be done in any place. Even if we didn't support it, we are dead.